Dr. Shannon Nix is an assistant professor of community and public health in the Department of Social and Public Health here in Ohio University. She uses the principles of community-engaged research to promote health equity. That's good. And Dr. Nix's research examines the influence of social support and social networks on health behaviors and outcomes related to rural, socioeconomic, and racial disparities in cancer, diabetes, mental health, women's health, and maternal and child health. So pretty much a lot of health issues in the urban areas as well as in rural areas. So without further ado, I will let you hear from Dr. Nix.
Thank you. Well, thank you so much for that introduction, and thanks to all of you for being here this afternoon. I'm really excited to be participating in Wealth and Poverty Week, particularly given the theme for this week, Identities and Inequalities. This work is really a great fit with that theme because so much of how we see ourselves and how others see us really influences our ability to reach our full health potential. And that notion really became evident as a part of the work that I'm going to talk to you about today, which was a project that I did with a group of African American breast cancer survivors in St. Louis, Missouri, where we looked at peer support and the role that that plays in their survivorship experiences. And it was really interesting. Some themes emerged about the African American identity, and understanding those themes is really very important to how we go about addressing some of the inequities that we see in breast cancer outcomes. So I'm really excited to talk to you about that today. So I think a good place to start is to first give you a little bit of background about breast cancer inequities. Breast cancer is the second leading cause of cancer death in women in the United States. Over the last several decades, we've seen some declines in mortality rates, primarily due to advances in early detection and treatment. And in turn, we've seen this growing population of breast cancer survivors. Currently, there are more than 3 million breast cancer survivors living in the United States. And as that population continues to increase, we're recognizing more and more that there are some specific healthcare needs around quality of life that are important for this population. But meeting those healthcare needs becomes a little bit more complicated when we start to consider some of the inequities that we see in cancer care and cancer outcomes. So if we compare African American women to their white counterparts, we see that African American women die from breast cancer at rates that are significantly higher. Beyond that, African American women are more likely to be diagnosed with breast cancer at a younger age. They're more likely to be diagnosed with more aggressive disease, like triple negative breast cancer, which is less responsive to breast cancer treatment options and is associated with a higher risk of recurrence. African American women are also more likely to be diagnosed at later stages, initiate treatment at later stages. They are more likely to receive suboptimal treatment dosages, as well as experience more psychological distress, depression, anxiety, have more difficulty adjusting to life with and following breast cancer. So there are a whole host of differences that we see between African American women and white women and other races as well with regard to psychosocial outcomes and quality of life, particularly during survivorship. So one of the things that has come up in the research when we're looking at these inequities is that social support is really important to improve breast cancer morbidity and survivorship for women of all races and ethnicities. And when we're talking about social support, that really consists of a number of different types of support. So I think what a lot of us often think about is emotional support, having people around you who are empathetic and care about you and the experience that you're going through. But in addition to that, it also includes informational support. Do I have all of the information that I need to fully understand the disease that I've been diagnosed with and to navigate the experience of treating that disease? It includes instrumental support, which is really about the exchange of tangible goods and services. So things like, do I have someone that can come and help me grocery shop or cook dinner or clean the house or pay bills if my illness is such that I can no longer really fully engage in those behaviors and activities. Beyond that, there is informational support. Do I have all the information that I need to understand my disease? And appraisal support, which is really about being surrounded by individuals who can help you process the experience of your disease and really adjust to your life with that disease. Peer support is a particular method of delivery of those types of social support. And peer support has well-established benefits for cancer patients. Receiving peer support has been shown to improve psychosocial outcomes for cancer patients, as well as helping them adjust to their disease. But there's very little evidence in the literature about peer support and its effects for African American women with breast cancer. So that was sort of the impetus for this particular study, looking at peer support and the delivery of that support and the experience of survivorship for African American women. So the organization that I worked with in St. Louis is called the Breakfast Club. The Breakfast Club is a group of African American breast cancer survivors. They've been working in the St. Louis area for a little more than 20 years now, and they were founded by survivors and completely run by survivors. They're not affiliated with any one healthcare institution. They are their own body in and of itself. And it's a really interesting story for how they started. The president of the organization was a breast cancer survivor, and she was in church one day and really felt compelled to share her story. So during testimony in the church service, she got up and shared her experience. After that, a younger breast cancer patient who had just recently been diagnosed approached her and asked her if she would mind meeting her for breakfast one morning to talk about her experience, to share what she had gone through so that maybe that would help this woman who had been newly diagnosed better experience her disease as well. So she agreed to do that, and after that meeting, a few more people asked if they could come along, and it grew over time. So currently they have a little more than 250 members who are all working to provide support through a monthly support group meeting, but they also have a one-on-one peer support program called the Buddy Program, where a longer-term survivor is partnered with a newly diagnosed woman to walk through the journey with her. And they also do outreach and prevention work. So they go out into the community, they do health fairs to provide education about breast cancer and to connect women to screening. So they do a lot of work in the St. Louis area around breast cancer. And we did some work. The institution that I was at the time was St. Louis University. This was my dissertation project that I did as a student there. And we worked with the Breakfast Club to do some of that outreach work. And in my conversations with these ladies, it became really apparent to me that they were doing great work to help improve outcomes for these women, but no one really knew anything about it. So there seemed to be this really great opportunity to work together to develop a research project, right? What's a question that we can ask that would help us understand this seeming expertise that this organization had around delivering social support to this group of women, as well as to help them collect some data that they could then use to promote their own sustainability for their organization. So increasingly, this organization is becoming dependent on grant funds, and you need data and proof of effectiveness in order to continue to secure grants. So this became sort of a mutually beneficial experience for the two of us, myself and the organization. And so we sat down and basically came up with these research questions. So we knew that we wanted to compare the experiences of women who were involved with the Breakfast Club to women who weren't. And so specifically, we were looking for the ways in which the peer relationships that form as a part of the Breakfast Club function to provide that structured community-based peer support, and then also what the perceptions of the benefits of receiving that type of support would be for those women over and above the support that they got from their other existing relationships, any other community resources they might access, and then any clinical resources that they might have access to. So what we decided to do was really multifaceted. So in the first phase of the study, we did participant observations at the monthly support group meeting that the Breakfast Club held, as well as key informant interviews with the leadership, both organizational and programmatic leadership for the Breakfast Club. So we attended 4 support group meetings, and we talked to 10 members of the leadership for the organization. And that was really to really get a better understanding of what structured community-based peer support actually means. What does that look like? How can we define that so that when we start to talk about perceived benefits, we really have a clear definition that we're providing to people for them to respond to. So that was the first phase of the study. In the second phase, we actually did sort of a quasi-experiment with 2 groups of African American breast cancer survivors. The first group of 12 was affiliated with the Breakfast Club. They received structured peer support through their one-on-one buddy program. And then the second group of 12 was not at all affiliated with this organization. We recruited them through a local cancer center, through a breast cancer surgical practice. And so we compared their experiences. So we conducted questionnaires and in-depth interviews with all 24 of these women. And they simply just had to have been diagnosed with stage 1, 2, or 3 breast cancer and have completed treatment prior to the study, but no more than 5 years before. We wanted to make sure that the 2 groups were as similar as possible in their characteristics and demographics so that the experiences would be comparable across the 2. And so with that data collection plan, the data analysis involved doing coding and coming to consensus on themes from the field notes that we took during the observations, as well as the interviews that we did with both the key informants and the survivors. So we had 2 separate coders who would take the transcripts of the interviews and take the field notes and code them independently for themes that were guided by the interview guide, as well as some theoretical frameworks around social support. And then we came together to come to consensus about what those codes meant and the chunks of text that were associated with that. Based on those text codes, we generated themes, compared them between the 2 groups of survivors, and that's how we came up with the findings for the study. And then the last part of that is because we had these different sources of information, the leadership from the organization as well as the survivors, we were then able to triangulate our findings. So we compared the findings from the leadership, the people who are providing the support, to the survivors and their perceptions to see how well they aligned with each other. So that process of triangulation. So what we found was really interesting. So I'm going to start first with the findings from phase 1 of the study, the observations and the key informant interviews. So the first piece of that was that peer relationships really functioned to provide consistent peer support to survivors. So the Breakfast Club's programs were specifically designed with goals and objectives to make sure that survivors got this support throughout their breast cancer journey. So whatever point they came into the organization, whether that was shortly after their diagnosis or years after they had finished treatment, the leadership of the organization wanted to make sure that women always received the support regardless of what stage of the disease they were in. And that's evidenced by the quote that you see here from one of the key informants that we interviewed. She emphasizes that it's the whole journey, including the follow-up period after completing treatment, that they focus on. And then one of the particular programs that we focused on was the Breast Health Buddy program, which was the one-on-one partnership for the delivery of peer support. And we noted during one of the observations that the buddies really talked about their responsibilities as providing all of those different types of social support: emotional, informational, instrumental, and appraisal support to survivors. And in the observation field note, we documented the description that one of the buddy provided to the memberships when she was talking about the program that she was a part of. And she said that the biggest thing for her was that she wanted the women that she worked with to know that if they ever felt like they needed to talk, whatever time of day that was, she was always going to be available to them. They can pick up the phone and get someone that they need to talk to. So for the organization, it was really about consistency, always being available, always making sure that there was access to the types of support that these women needed. Next, we found that the peer relationships as a part of the Breakfast Club are also designed to promote that exchange of support between survivors in ways that other people may not be able to do, right? There's something distinct about being a fellow breast cancer survivor that a husband or a spouse or a child or a sibling will never really understand. So this, the observations that we conducted during this period really demonstrated how those breast cancer survivors were able to fill that role for their fellow survivors. It really provided opportunities for women to see other women like themselves surviving from this very traumatic experience long term, right? They saw that there was a way to deal with the stress that's associated with breast cancer and sort of have this positive outlook on things. And so we really felt like that mitigated the feelings of distress that might emerge and to really help survivors change their perspective on the diagnosis that they had received. And so we documented this in one of the observations of a survivor who was talking during the sharing portion of their support group meeting. And she explained that she had all of these encounters with people who told her that she should keep her diagnosis private, that it really was no one else's business. People would pity her, they'd treat her differently, and it was really this negative problem that she had to deal with. But she explained that because she had gotten involved with the Breakfast Club and really got to experience her journey with people who were like her and who had also shared a breast cancer diagnosis, that she was able to sort of shift her outlook, that she saw herself not as a victim, but as a survivor. This was something that she could process and move forward. And then finally, from the key informant interviews and the participant observations, we also noted that the organization really had a focus on making sure that each survivor was actively engaged in her health and her health care. So there were particular moments in observations of the support group meetings where we noted that the leadership was delivering these messages of being involved and engaged in your healthcare, but there was also an exchange between the members themselves for those same messages. So in the first quote from an observation field note, you can see that there was again a buddy talking to the membership saying that they should always keep their doctor's appointments and make sure that they know what's going on with their bodies, right? So it's not enough to come and get support, but you also have to be an active member in your health and your health care and making sure that you know what's happening with you. And then at a second support group meeting, we caught this exchange between a couple of survivors who were talking, and she was expressing to a fellow survivor that being a part of the Breakfast Club really helped to save her life from her perspective. That because she had become a part of the organization, she really learned about the importance of her own health and managing her health. And so because of that, she became more engaged in keeping appointments, and she caught other health issues like high blood pressure, and that she was able to take care of them. And if she hadn't gotten involved in this organization, she might have let those things slide. So really recognizing that promoting active engagement in the healthcare was a goal of the organization here. So then shifting to the second phase of the study, these are results from the interviews that we did with the breast cancer survivors themselves. And the way the slides are structured is to give you example quotes from a comparison survivor who was not affiliated with the Breakfast Club at all, next to a quote from one of the survivors who was affiliated with this support group. So the first interesting theme that came up in our analysis of these interviews were that the survivors between groups seemed to differ in their capacity to access and utilize alternative sources of support. So we all have people in mind who would be our go-to person if something happened to us and we needed to get support from someone. But what we found is that for a lot of survivors, you might think you have those resources for support, but when you really need them, they may or may not be there for you. So this particular example is for survivors who had sources of support who were actively engaged, but This finding was also true for people who had sources but didn't really want to utilize them, or had really strained relationships with the people around them, and weren't necessarily able to rely on them for support. So what we found here is that regardless of the situation, the women in the interviews really expressed their need to have someone else to rely on for support. So in the comparison survivor, we have a lady talking about her husband, how supportive he was, but the fact that he didn't always understand everything that she was going through. He just didn't get it. And so she did not have anyone else to turn to who may understand better than her husband did. But when we look at that same sentiment in a survivor who is affiliated with the Breakfast Club, she again talks about her husband, how he was really useful, he was there for her, but he still didn't understand everything. But because she had the affiliation with the Breakfast Club, she was able to turn to her buddy and to get the support from her buddy in a way that her husband wasn't able to provide. So regardless of the nature of the relationships of these survivors, the difference was that women in the Breakfast Club had someone else to turn to when their natural relationships weren't able to provide them the support for whatever reason that might be. The next finding here was that the survivors also differed in their capacity to acknowledge and process the emotional stress that's associated with receiving a breast cancer diagnosis and undergoing treatment for breast cancer. And this idea of strength really came out very strongly here. So regardless of the group, across both of those groups, the survivors really emphasized and valued this notion of being strong and being able to handle things on their own and not needing other people. But the receipt of consistent peer support really provided the opportunity for the survivors that were affiliated with the Breakfast Club to be emotionally vulnerable about what they were dealing with. And that's evident in the quotes here as well. So in the comparison survivors quote, we see that she really had a hard time dealing with cancer, right? She had had a difficult childhood, and because of that, she just felt like cancer was another devastating thing that happened to her, but she couldn't process it. It's just something else that happens in life. I'm going to keep moving forward. That's just what my life is, one bad thing after another. But with the Breakfast Club survivor, you see that she may have had the same sentiment in the beginning, but she went to the support group meeting and she became involved in the Breakfast Club. And she said for her, that was the first time in her whole experience that she had ever allowed herself to cry. That she was able to listen to the other women, tell their stories, to talk about what they dealt with, the struggles and the challenges that they had had emotionally, and she could relate to them and she could let herself be vulnerable in a way that she may not have been able to do otherwise, which was evident in the comparison survivor. Also, with regard to acknowledging and processing the emotional stress of breast cancer, dealing with the treatment and the side effects that are associated with breast cancer treatment can be really difficult for survivors as well. There are a number of side effects that emerge from chemotherapy and radiation that are long-lasting and may alter your life long-term, forever. It may never go back to the way it was before. Numbness, pain, skin burns from the radiation, all of those things are problems. And so dealing with that was really difficult for survivors, regardless of what group they were in. But the Breakfast Club survivors utilized the support in a way to help them process the challenges of dealing with those side effects. So in our comparison survivors quote here, we see that she's really stuck and focused on the things that she used to be able to do and can no longer do because of the side effects of her treatment. And she hasn't been able to figure out a way to get past that. But the Breakfast Club survivor talks about the side effects of her treatment, very similar. Neuropathy is the pain and numbness that the comparison group, the comparison survivor was speaking about. So she's talking about dealing with those same issues, but she also focuses on a solution to her problem, right? She's identifying exercising as a way to cope with the challenges of that side effect, helping to keep her mind clear and to sort of process that emotional stress. So again, same issues, but the way that these women are dealing with it are very different because of the support that they get from the Breakfast Club. So here in this finding, the groups also differed in their reported levels of psychological distress and their overall quality of life. So the Breakfast Club survivors more often reported ways of dealing with their distress. So that might be symptoms of depression or anxiety when we talk about distress here, as well as being better able to adjust to their life as breast cancer survivors. So we see this evidenced in the quotes again. So the comparison survivor here is talking about how she always saw herself as a strong person, but recognized that she was struggling. She felt depressed. She wasn't really able to move past her experience. She was very stuck in the fact that her life was different, and she couldn't really do anything to change that. The Breakfast Club survivor also talks about experiencing those things. She talks about her anxiety, the worry that she still has, and recognizing that her life is never going to be the same after having this breast cancer diagnosis. But again, she's talking about this through a positive lens. She mentions the fact that she's looking forward to her new normal, right? She's recognizing that this diagnosis, this disease has changed things for me, but I have something to look forward to here. And she credits being a part of the Breakfast Club as the reason for being able to sort of change her perspective on that. So with those two sets of findings, we compared the two to see where there were alignment between the sources of information to sort of generate these overarching findings for the study with regard to peer support. And so primarily what we found is that the peer relationships, that exchange of peer support between fellow breast cancer survivors is really about assuring access to consistent quality social support, whether you have social support from other sources or not. And that was evidenced in both of the sources of data. We constantly saw references to the consistency, always having access to that support. Beyond that, we also found that the structured community-based peer support really allows survivors to process the ongoing stress of breast cancer, and that in and of itself may result in better psychosocial health and quality of life. So we see here that the leadership of the organization and through the observations, they talk about how that support mitigates the feelings of distress. We saw it in the survivor interviews when we saw the difference in the group of survivors who were affiliated with the Breakfast Club being able to talk about the ways that they coped, being able to utilize strategies to deal with stress, where we didn't see that in the comparison group. So what we take away from this is really this idea that the peer relationships that form in an organization like the Breakfast Club really promote social connectedness and post-traumatic growth by providing that consistent, structured, community-based peer support. So what that means is that they have a place where they can go and belong and be a part of a group of other women who are like them. That connectedness to others, having that access to social support, helps improve outcomes. People who are socially isolated tend to be less healthy because they don't have access to social support. Post-traumatic growth is this reference to the ability to see a positive outlook from a traumatic experience. So we saw that in a lot of the quotes from our survivors who were affiliated with the Breakfast Club, being able to focus on something negative that had happened to them, but see something positive coming out of it, identifying that silver lining as a part of their experience. And so that really happened as a function of the relationships that they had with other women who were like them. Beyond that, we found that the peer relationships really function to promote engagement or taking an active role in one's healthcare. And we felt like this was likely a goal of the organization because that limited engagement in healthcare is thought to be linked to some of the inequities that we see in breast cancer outcomes. And I think once women started to get involved in the organization and recognize the importance of health, they wanted to make sure that they were passing that message on to other women as a part of the support that they exchanged between each other as well. So then thinking about the perception of the benefits of receiving that structured peer support, we found, generally speaking, that structured community-based peer support really promotes improved psychosocial health and quality of life. So what we found in the interviews with the survivors and that notion of strength and being strong and independently being able to handle things without being a burden to anyone else really falls in line with the narrative that we often hear about African American women and their identity, this notion of being the strong Black woman. It's also referred to as the superwoman schema. So it's the idea that Black women have to carry the role of being the matriarch. They are the one that provides for everyone else, and it's not okay for them to ask other people for help. That's their job, to take care of their spouses, their children, whoever else that might be. But being a part of the Breakfast Club and receiving that structured community-based peer support really allowed them to step outside of that identity, right? It gave them a place to go where they could be vulnerable, ask for help if they needed it, to let off a little steam, process the stress if they needed to, without it necessarily bleeding back into the other areas of their life where that identity was essential. So it was really interesting for us to think about how peer support might allow women to process their disease in a way that they might not otherwise be willing to or able to, given the roles that they have to carry out in the rest of their lives. So there are a number of strengths and limitations that we have to take into consideration when we're talking about this particular study. So the strengths, I think, were the community-based participatory approach. So we involved the members of the Breakfast Club, the survivors, and the leadership of that organization from the very beginning. They really put forward this research question in partnership with us. They were involved in helping us to make decisions about how we collected data. We went back to them after we did the data analysis to make sure that our interpretation of what they said was accurate. So they were really involved in every step of the research process, which I think helps to make sure that the findings are more relevant to the population that we're focused on here, and will help to make sure that the decisions that we make about intervention development are also going to be relevant and responsive to this particular population. Because we utilized qualitative methodology in this study, it really allowed us to get rich, in-depth information about peer support, about the experiences of African American women in a way that other methodology would not have allowed us to do. So in this way, I think we really gave a voice to these survivors and they were able to express themselves. The comparison group design, I think, really helped to establish some rigor in the study. Being able to sort of take a look at the experiences of people who received that peer support in addition to folks, in comparison to folks who didn't, but in the context of all of those natural social relationships that we all have, I think really helped to make sure that the findings were also relevant and would be fitting for people in their everyday lives. And beyond that, I think this particular work gives us a starting point to think about future research and public health efforts around making sure that people have access to adequate quality social support. The limitations for this study, though, are that it was retrospective in its focus. So we talked to these survivors after they had finished treatment. So we were asking them to sort of look back on points throughout their experience and recall how they felt about it. And, you know, over time, the way we respond and think back about different things may change a little bit. So that may have influenced some of their responses. Selection bias might have also been a problem for this particular study because of the nature of the study and the way we recruited women to be a part of it. There may have been a difference between the people who were willing to be involved than people who perhaps weren't willing to participate in an interview like this. So it may not necessarily be relevant to every woman with breast cancer, just given that there may have been some differences in those who decided to participate. Beyond that, social desirability might also be a problem here. We did ask some questions that have socially desirable responses. So did you regularly attend your treatment appointments, right? Those things that people would naturally say, of course, I did that. So those things might also be a problem here as well. There may have been instances where the experiences weren't accurately represented as well. But we did try to assess things in multiple ways so that we could try to get around that as much as possible. So there are a number of implications that we think are important for this study, primarily for public health and clinical practice. The findings from this study really help us to understand, to expand our current understanding of the role that peer support plays in the cancer experiences of a really understudied population. There's not a lot of information available in the literature about African American women with regard to peer support. So I think this really does expand what we know about it, and it does help us think about how clinicians might better be able to recognize people who might need additional support resources, and the fact that everyone may not present themselves in a way that seems obvious that they need additional social support. Again, I think because of the community engaged nature of this work, it really did help to strengthen the partnership between this community-based organization and the academic institution that I was with at the time of this study. It did sort of provide a foundation for us to continue to build upon for additional work going forward, and I am still working with that organization today, and this is a couple of years later. So we were really excited about that. And again, the data that we collected is the Breakfast Club's data, right? They get to house this data and keep it, and so it really helps them present some evidence of how their programs work and how effective they may be, so that they can then use that to help promote sustainability for their organization as well. And then beyond that, this approach that we took to understanding social support and peer support for breast cancer also gave us a process to utilize if we want to examine these same subjects in different healthcare outcomes. So I'm also taking a similar approach and looking at the role that peer support might play for people who have been diagnosed with type 2 diabetes and how that might influence their ability to engage in self-management behaviors. So this really did help to define a new theoretical process to utilize. So I just want to, of course, acknowledge the members of the Breakfast Club. I couldn't have done this work without them. My co-authors are also listed there, and then just to disclose the funding that was utilized to support this study. Okay. All right, so that's it. Thank you. So I'm happy to answer any questions if anyone has any.
Why would you say that African American women don't have as much access to these types of peer support groups?
So many times, so first of all, let me say peer support groups are rare in and of themselves. Most often we think about cancer support groups, but they are typically affiliated with a clinical institution. Many times they're run by a nurse or a health educator, and they are often open not just to one type of cancer, but to people who have a number of different types of cancer. And so the experience of being a part of that often means that certain needs go unaddressed. So one of the things that, that came up for the survivors that we talked to in this study was the importance of spirituality and being able to talk about the role that religion and God plays in their experience. They also talked about going to other support groups to learn how to apply their makeup after the skin changes, or to get wigs after they've lost their hair from treatment, but not having makeup and wigs that were suitable for someone of their skin tone, right? Only finding things that were relevant for white women. And so that experience can be very isolating. And so rather than attending those types of support groups, they would just not go. But the truth of the matter is peer support groups are rare. There aren't a number of them in existence, but they're emerging as people begin to recognize that there's value in receiving support from other people. So I think it's a growing strategy at this point. Other questions?
You talked about this and that implications for public health. So let's say you conducted this research in St. Louis. So let's say, how could the St. Louis city government make use of these support groups and networks to improve public health? So I assume there could be many things. So let's say you talked about those clinicians, their clinical practices. So they would make use of them, what the location of those clinics. So it'd be great.
Sure. It's really interesting, especially for when we start to think about some of the challenges that are present in rural environments and thinking about urban environments. The women in this study really faced a lot of the same challenges that I think women in a rural area might face. They were sort of segregated to one particular part of the city, access to their healthcare facilities where treatment were, required them to travel 20, 30 minutes by bus if they had access to the bus, if it came all the way out to the county where they were. So all of those things became a problem for these women, just like women who lived in a rural area might have difficulty accessing transportation to treatment. Beyond that, though, thinking about how the St. Louis government might support this issue, a lot of the leadership for the Breakfast Club really felt like they were an entity unto themselves with no support from the public health system, from the St. Louis government. They were there to figure out how to exist on their own, which is part of why they were totally dependent on grant funds. So if there was a way with this study, and part of what they're trying to do is demonstrate to stakeholders how effective this actually is, what a difference this can make for a huge population in St. Louis. And so with that, they're hoping to get support from the public health infrastructure in St. Louis to support their efforts. They're in talks with a number of the providers around town to make sure that they know about this and how it works, so that they can then make those referrals to patients who are coming in for treatment in their different practices. So it really is about getting them integrated into the public health infrastructure, and then making sure that all of the key stakeholders, whether that's leadership within the public health infrastructure or in the city government itself, recognizes that and then puts resources behind it. Right now, they are sort of existing from their own sort of efforts and the resources that they can access. So it's a challenge. Yes, Mia?
Do you have any plans for further study that can show the impact of such groups on survival rate for breast cancer women?
So what we are doing now is really sort of taking a step back and looking at the broader social support picture and landscape for women with breast cancer, because peer support is only one part of that, right? And it doesn't happen in a vacuum. It does happen in these other relationships. And so we're wanting to really get a good understanding of that first before we start to think about how we can develop this into an intervention that can be more broadly disseminated. But the truth of the matter is, this is sort of an intervention on one level with individuals. And so many of the factors that contribute to the racial inequities that we see in cancer care and outcomes are much higher up in the socio-ecological framework of thinking about these issues, right? They're institutional problems with the healthcare system, right? The fact that an African-American woman can be diagnosed with a disease and not receive the same level of care that a woman of another race might receive is a problem, and that's a systems level problem that requires a different type of intervention. So while we're sort of learning about and recognizing what those other issues might be, we still need to figure out a way to help improve outcomes for women in the meantime. So that's sort of where this intervention might fit, but we're also sort of thinking about broader systems level change in addition to that, in order to really see changes in overall rates and to reduce the gap in the inequities that we see, if that makes sense. Yeah.
Any other questions?
Okay.
I have one more question here. It's about the data collection part.
Sure.
I think that you conducted this wonderful research method. So it would be really good for you to tell our students about how you conducted the personal interviews,
Sure.
or questionnaires, how you approach your
Absolutely. I can do that.
informants and
Let's go back a little bit so we can talk to this
those
piece
who are
by
from
piece.
urban geography class, that's the kind of research you're going to do for your term paper,
There we go.
wasn't it? There's a personal interviews, participation, observation, those things.
So, as I mentioned, the majority of the data collection methodology that we used was qualitative. And there are a whole host of different lenses through which you can conduct qualitative work. And so for us, this was a little bit grounded theory. So we're doing some inductive work, trying to explore and learn as much about it so that we can develop some theories and ideas about peer support. And some of it was ethnographic, really becoming immersed in the experiences of these women so that we could better understand what they were dealing with. So the first piece of that that we did were the participant observations. And this was really the ethnographic piece of the process. So observation can be done in a number of different ways where you are sort of external to what's actually occurring and you are documenting that experience for the participants. There's also a part where you are actively engaged in what you are observing. And that was what we did. So part of getting involved with this organization really required a lot of legwork. I had to establish a certain level of trust. Many of you, I'm sure, are aware of the negative history for a lot of African Americans with regard to research and an unwillingness or a hesitation to be involved in research if they don't really understand what's happening and what your motivations are. So before this study started, I actually spent about a year going to the support group meetings and getting to know the women, talking to them about myself and my experiences, why I wanted to do this work, so that they could get to know me and understand what my role was going to be in the work that we were going to do together for this research. So for the participant observations, I actually went to all of the support group meetings. I sat in the circle with everybody else. When it was my turn to share, when they went around, I shared what I was thinking in that particular moment as a part of this. And so I was also documenting the other things that people were saying, but I was actively a part of the process that was taking place. The interviews that we did, both with the key informants and the survivors, required us to do a little bit of legwork first. So we needed to think about the information that we wanted to get and how we were going to collect that in the most effective way. And so that really took us back to understanding the questions we were asking about social support and how social support might work to help deal with the stress of breast cancer. So we identified a theoretical framework that we thought exemplified what that relationship might be. And we developed questions based on the different constructs of that theory and those relationships. So once we had our interview guides in place, we then asked the questions of the key informants and of the survivors. We audio recorded every interview. Then, because I was a doctoral student at that time, and this was my dissertation, I didn't have a lot of money to do this, so I sat with a student and we transcribed every one of these interviews, which was painstaking because it was 34 of them total and they were all about an hour and a half apiece. So I think before it was all said and done, I had close to 700 pages of text that we then had to code by hand. So it was a lot of fun. But that is the process, right? That's how you do qualitative work, and it's really how you generate those interesting themes and stuff that you come across once you are sort of immersed in the data that you found. And so with the analysis, that same theoretical framework that we used to guide the development of the interview guides, we also used to guide the coding process. So we generated codes based on those same constructs and pathways in the theoretical model, but we also left it open to create new codes that might come out of the data that we hadn't anticipated ahead of time. So there may have been things that people talked about that were completely new to us that we didn't anticipate. So we created codes for those as well. And coming to consensus on that was really this iterative process. So it took multiple times of meeting and talking through where we were, debating about whether or not I was right or my second coder was right, and coming to consensus on those things before we generated those themes and made comparisons and then triangulated between the sources of data. So it's a process, and people train in qualitative methodology for years before they really get good at it. So this is just sort of a surface level overview of the process, but if you're interested in it, I would encourage you to take a qualitative research methods course to really learn how to do it well. It's a really useful methodology in terms of really understanding the people that you're working for and with, and getting more information about particular topics that you're interested in.
Any other questions?
Thank you, everyone.